Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Zoe Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's episode. We are talking about the elbow today, and the reason why we're talking about the elbow is because it's often overlooked, and it's definitely not a joint that I was aware of as a vet until I met Sharon May Davis, and then became a little more interested in, well, everything anatomy, but yes, the elbow was one area that was highlighted. How are you today, Soph?
Going well. I learned about the elbow from you when it came up in, I suppose, one of the subjects I was doing with you at uni, and I definitely am, always humbled every time in the dissections I've been in, having a look at the inside of the joint and also getting to understand the anatomy around the elbow a bit better, just how connected it is to everything below it and then everything above it as well.
Yeah, it's quite an important connection area. Like for all of the distal limb muscles, like the flexors and the extensors, they all have attachments around the elbow. The pecs have quite a few attachments around the elbow, which are part of the thoracic sling. And so, even though its function is limited to flexion and extension, it can be impacted upon by other areas, that change the motion of the joint itself, like change the forces that are going through the joint specifically. So we're going to kind of look into that and discuss it. And, I guess a highlight for me when I learned about it through Sharon was how important good posture is to support optimal elbow function. And then when I started really looking at how horses were moving, I saw that most horses weren't moving in a way that utilized their thoracic sling and stepping out from the shoulder. A lot of them were not initiating movement in the right places, and so the elbow comes under just altered biomechanical forces, is probably how I would describe it. Like it just can't go through an optimal flow of motion. So if you want to talk us through a bit about the anatomy of the elbow joint.
So the elbow is a hinge joint. So there's three bones in it, and there's the ulnar and radius, which are, in us, that's two bones, but in the horse, they are actually fused together. And there's also the humerus, which goes between, it also attaches up to the scapula. So it's sort of like between the point of the shoulder and the elbow is the humerus, and then the radius and the ulnar go from the elbow down towards the horse's knee. And so there's three bones there. And it's a hinge joint that goes straight. So it's got flexion and extension. So the joint just opens and closes. But the interesting thing is when it straightens, it doesn't actually go into a straight line. So it doesn't end up forming a straight line like the knee goes straight through it down into through the knee joint into the cannon. But with the horse's elbow, sometimes it looks like when the leg is out behind, like it's an extension behind them before they pick it up and bring it forward. It looks like it's gone straight, but it hasn't. It can only get so far closed because there's what's called the olecranon that actually blocks the limb from going any straighter. And I know we're technically on audio, but I have an elbow, a set of bones, a forelimb here. So if we end up putting the video up on YouTube, you'll be able to see this. But if you imagine that it's kind of like there's a projection up the back of the radius and ulnar, that's the olecranon, and it can only go so far into a little fossa of the humerus. And so you imagine that as it's opening the joint, so it's going towards straight, it actually kind of notches in there and can't can't go any further. So it's very secure in that position. And yeah, so that's another reason as to why, as soon as you have altered biomechanical forces going through it, either coming up from the foot, down from the spine and the body, or both, that's a place where there's not a lot of twisting motion or anything like that. So as the force comes through it, that it kind of doesn't have anywhere to go. It doesn't have a lot of accessory motion to absorb that. And so it usually takes it as a concussion or a grind.
Just kind of changes the angles a little bit, and then it can just it happens in the hock as well, where just little changes to those angles can cause the bones to kind of almost rub in just a little offline of what they should be. So, and the ligaments, the collateral ligaments, there's collateral ligaments on the inside and the outside of the elbow, and that's what keeps it in that alignment. And so they're really important for that function. The elbow, obviously, because it goes in flexion and extension, it has flexors and extensors. So when we're talking about flexing, we're talking about, like if you if you pick up the leg as if you're cleaning out the hoof, and then you fold up the carpus, the knee, and fold up the limb, that's flexion of the elbow, So that's probably the easiest way to see flexion is kind of fold the limb up on itself. Extension occurs when the leg comes out in front. But then you also have extension out the back in the caudal phase as well. So, that like with us, we don't, well, I guess we can put our arm forward and have extension, our arm back and have extension, but it's kind of the same extension. But in horses, it's a little bit different when they're going forward or back. So the flexors, the muscles that create the flexion are the muscles on the front of the forelimb, the ones between the elbow and the knee. So extensor carpi radialis and the common digital extensor are running down the front of the forelimb. And then the big one is the biceps brachii, which runs kind of over that shoulder area. And I want to talk a bit more about this because I think this is a really important muscle for elbow function. And then the brachialis is a deeper muscle. We call it the dunny muscle because it has an S bend in it, and it goes around the back of the shoulder joint. And so, but it also is important in elbow flexion, and it goes quite deep, but there's a little area where you can access that superficially. So they're the flexors, so they're the one creating the flexion. The ones creating the extension are the ones more on the back of the limb between the elbow and the carpus. So you've got the flexor carpi group, which have attachments on the inner aspect of that olecranon. So the flexor carpi radialis, the flexor carpi ulnaris. The superficial and deep digital flexors also attach into that area, although the deep has 4 insertions around and above the elbow. So that medial kind of olecranon area, medial elbow, inner elbow area is very important for, function of the whole distal limb. The ulnaris lateralis sits on the outside attaching to the olecranon. The tensor fascia antebrachii is also involved more in the caudal extension, and it has to lengthen in the cranial extension, is attaching to the top of the olecranon. The triceps muscles, there's 3, and they have attachments. They kind of cross the elbow joint and come down to the olecranon as well. And then the anconeus is a little bit involved in elbow extension, but the anconeus goes across the joint capsule. And so it's quite important that when the elbow's in extension, it lifts the joint capsule out of the joint space. And so it means that the joint capsule doesn't get pinched in there and create inflammation. So yes, the muscles involved in elbow flexion and extension are also really important for limb biomechanics. Also, all the muscles that we've just talked about are part of the stay apparatus, And so the stay apparatus is what creates efficiency for the horse in standing. It's the intrinsic muscles of the limb, so they're muscles within the forelimb that actually keep everything in its position. Without those muscles, the carpus buckles or the fetlock falls down, or the scapula would like collapse towards the elbow. And so the stay apparatus and the function of that stay apparatus is very important also for elbow function. And then one of the important nerves specifically is the radial nerve, which kind of comes the back around the back of the elbow. And when it gets atrophied or damaged, when it gets damaged, it creates atrophy of like the triceps, and then the elbow really loses a hell of a lot of support um, in that function. So, yeah, that's just a bit about the anatomy of the elbow.
I think it's important to point out what you're just saying about the fact that they're intrinsic muscles of the forelimb. That means if you have the forelimb bone, so that's going from the scapula down to the coffin bone, like inside the hoof, any muscle that starts and ends on those bones, so the limb bones are called intrinsic muscles, and your extrinsic muscles, there's lots throughout the body, but it's called the extrinsic thoracic appendicular muscles. So those go between the forelimb and the body of the horse, like the rib cage and the spine and the neck. So you can see how the stay apparatus is there to lock the actual bones of the forelimb and hold it up. And that's why your horse can stand up for so many hours a day, because just with the way that the elbow locks in, what happens is those muscles just hold a little bit of tension. And so it's a quite straight up and down system where basically the horse is just resting on top of those. It's like a stacked limb when that elbow locks in. So it's a very secure unit. And then your extrinsic muscles, we were saying, go between the limb and the body. Some of those are like your thoracic sling muscles, or the thoracic sling. And so they are working to hold the rib cage and the body up in between the two front limbs. So you've got different groups of muscles, and we'll talk more about how, like, the influence between the two of them, they're very connected, but we can kind of group them based on a particular role as well. Like they influence one another, but they're meant to do a certain role, this group of muscles. And so that's why the elbow is so affected when you have an issue between those. But yeah, the stay apparatus is so important.
Yeah, and then you kind of mentioning the thoracic sling there, like at the start, I said how I recognized posture is so important to support the elbow. And, when we think about what kind of things are going to influence the elbow, then one of them is going to be thoracic sling function and posture, core function, their horizontal balance and stability from front to back. So are they loading up their forelimbs? Are they able to shift the weight off the forelimbs and use them properly so that they can, utilize the shoulder and the scapula to create a flow-on effect through the elbow. So that's really important. And also with the biceps, like Sharon's talked about it having a locking mechanism too, in the humerus, and that I think in a lot of horses, a bit like the locking mechanism in the patella, it becomes a bit weak and sloppy, because the biceps is not trained properly when horses have their head in a flex position and aren't lifting through the base of the neck and the rib cage. Like they're what we call leg movers. And when horses become more leg movers, the biceps doesn't get utilized in the same way as a horse that's like stepping through with the shoulder. So we want to, optimize that posture. The other aspect, I'll let you talk about hoof function, but is the pectoral function and the stability that creates through the rib cage. So that's going to, and they have a lot of connections across to the elbow, around the elbow joint. Also, the way they're utilizing their lower neck and their spine in general is going to reduce loading on the limbs. Like if they've got optimal upper body biomechanics, then you have a lot less load going through the distal limbs. Um, Same with like triceps, if they're functioning optimally and they're comfortable, you can get a lot of trigger points in the triceps because of strain or other neck issues and things like that, and they're going to influence elbow function. And then a massive one is saddle fit and the influence that that has on scapular motion. And if our scapula A is not sitting in the correct position and B is not able to go through a complete range of motion, then somewhere else has to take up that force. So if motion is restricted in one part of the body or one part of the limb, then there's still that energy has to flow through the rest of the limb. So if the scapula can't move, then often it's the elbow, because it kind of does come into a bit of a locking position. It really changes how hard that hits. Like, so as the limb comes into weight bearing, goes through its weight bearing phase, like it changes the forces that kind of go through that elbow, and the smoothness of the motion. And so, yeah, we really need to optimize scapular function, saddle fit, posture to help support the elbow. So do you want to talk about hoof balance? Because we see a lot of elbow changes when there's been a lot of hoof problems.
Definitely. So, yeah, I mean, there's also, you've got the links, the anatomical links. We are just talking about the extensor muscles that go all the way down. You've got your flexor muscles. You're saying your deep and superficial digital flexor muscle and tendon. So the muscle and tendon, you can imagine how long that structure is because it's going from the elbow joint. I just hold up my bones again and describe it a little bit. The idea that you have, if you imagine you've got your humerus and then you've got your radius and ulna, there are connections that cross that joint very close to the joint itself. So you've got the tendon that goes all the way down, goes from about the carpus, then going down the back of the cannon bone, so the knee, then going back down the back of the cannon bone and attaching down into the bottom of the coffin bone, so the bone that's inside the hoof capsule. The muscle for that tendon has come all the way up the back of the radius and ulna and is attaching around and beside the elbow joint itself. So when you have a change in your hoof balance or your hoof function, you're going to have a level of tension or a change in function coming all the way up the back of the leg and influencing the elbow. So for something like if you have a hoof where the bony column, so the bottom of the hoof isn't, and the frog isn't contacting the ground very well, the frog and the digital cushion don't really have ground reaction forces in which to disperse and load. And so the bony column is traveling down, then you've got the deep digital flexor tendon attaching into the back of that bone, which is under a changed level of pressure and loading. And then because the body alters its function and then structure to adopt to that, you're going to have a level of tension coming all the way up through to affect the elbow as well. So the level of the health of your foot is directly going to impact the concussive forces coming up. And if you have a tension in those muscles, I mean, I personally sometimes will see horses that it looks like they're literally pulling themselves along their flexors. Those muscles are so big and so tight, and see them in foals often where just good quality body work allows the leg to straighten, like the knee will be a little bit bent, they're kind of tucked up, and they have sore feet and their elbows are being impacted. So if the muscle crossing that elbow joint is very tight, it's compressing the elbow joint as well, which again is going to increase your concussion and your grinding motion as the forces travel through it. And as you were saying, if you bring the leg forward and you load it in extension while it's locked and your saddle fit is in maybe impacting your scapular function, or you have some sort of dysfunctional thoracic sling, as you load down into it, you don't have that same level of fascial sling and buoyancy that then travels through your tendons and the tendinous muscles of the elbow down into the foot, so that you have this kind of net or sling action that travels not just thoracic sling, but sling all the way down to the foot, that you have this beautiful kind of um, loading that disperses nicely into sort of an expansion through all of those tissue and then can kind of suck back up through them as you unload it without having those concussive forces.
Yeah, like we really see that under dissection when, you look at the fascia going into the frog and you can pull on that and see the motion up around the elbow area. And so that really demonstrates that connection that, not just the muscular connection, but the fascial connection through the limb. The other aspect that we see too is when the horse has a low heel and a high heel, that changes the forces that go through the elbow. So, especially on the high heel side, you tend to see more changes in the elbows. And again, that's the concussive forces through loading and the way that it's kind of changing the smoothness of the landing phase specifically. So, yeah, hoof balance is integral in that. So when we see alterations, like when they've got an underlying elbow issue, some of the things that we might see are like the elbow might seem more tucked into the body. They can also have this instability in the landing phase. And Henry, one of my thoroughbreds, he has a great example of this, where so as they come, and he's very upright in his feet and he's got quite short pasterns. And so as they come into landing, especially in like just the mid stance phase, just before the mid stance phase, and then so when it's in the most point of loading, you see this kind of wobble. And so some people see the shoulder wobble or the elbow wobble, but it's like the whole leg kind of like wobbles back and forth, and it's quite unstable in that position. And often with these horses, if you slow them down, it'll become more pronounced. And if you put them on a downhill, like Henry would grunt when he was being asked to walk downhill, and he wouldn't walk, he'd stop. So I'd have to like zigzag him down to help him get down. And so what helped him was actually when I taped there was a few different taping methods that we tried that all made a difference. But taping his biceps brachii and giving him a bit more like support as it goes into that landing phase and the caudal phase. And then over time, as we did more postural work with him, the elbow instability improved like quite significantly, and I didn't need the tape anymore. So, yeah, that instability is really important to look for because if they have that, then you don't want to add to it by doing hill work, asking them to go downhill, asking them to go slow if they're too unstable. Like you want to just create the most optimal support in their biomechanics. So that's, yeah, really important to see. Um, we're going to go into pathologies, but I just want to say, because with that particular elbow motion, that's what Sharon has correlated with changes where there's like a wearing of the radius, ulna and humerus. And so, there is a normal synovial fossa within the radius, and it kind of goes back into the humerus. It's normal, but these ones, it's gone into the humerus and it's often worn down to bone. And at times the joint capsule itself can be very inflamed. And I know of other lameness vets, one in particular, who's done some studies looking at the biomarkers in elbow, so the inflammatory biomarkers. And he's noted that, the elbow is a joint that we need to look at, whereas a lot of vets are not. They're not looking at it as a source of pain or lameness. And I would also say that it's not often a cause of lameness. I've seen it as a cause of lameness a few times, but it is a cause of dysfunction. And it definitely changes the quality of the biomechanics. So I think that's where we get caught up is not every point of discomfort creates lameness in the horse.
So if you were to name a few elbow pathologies, genuine pathology of the elbow, what would spring to mind?
Yeah, so you can get capped elbows where they've kind of the bursa on top of their elbow, on the top of the olecranon becomes inflamed. Sometimes they've kicked themselves. Um, that's a common one, like, when they're laying down or from flies. Um, Injuries to the ligaments, the collateral ligaments. So I had one pony that I dissected, and its elbow, like usually it's pretty easy to get into the elbow under dissection. I could not get into her elbow. It was so restricted. It was a mess. It was an absolute mess around there. And we kept her skeleton, and she had severe arthritis in her elbow, and around those collateral ligaments. And she'd obviously had some kind of really traumatic accident um, with that. And she didn't move her elbow when she moved. She actually like swung the leg around. So definitely that. Arthritis. When vets are generally looking for arthritis, they're looking at more on the like front edge of the joint. Um, but with the pathology that Sharon has noted, it's not on the front edge of the joint, it's actually in the back of the joint, where, like the hock, where potentially a lot of force builds up in that area. They can also get OCD, which is like where the cartilage is weakened, often more in young horses. And sometimes that can also be related to cysts, like subchondral bone cysts. Again, more in young horses, but probably when I've seen those sorts of changes, there's been a lot of hoof balance issues in the horse. But it's chicken or the egg, right? Like, which one started first? The hoof balance issues or the elbow and other dysfunctional patterns in the body? So,
Absolutely. And I mean, where it's not just dysfunctional patterns. I mean, myself, Charlie in the paddock here has done a traumatic injury to his elbow, I think twice, once on each side. And one of them I saw, he just had his foot in something, he's pulled back and he's genuinely tore it. And now his elbow is less stable. And
yeah, he did a good job on his
he did,
triceps.
he did do a good job of tearing his tricep. So that is going to be well, actually, to be fair, I think the chicken and the egg is which one came first, the chicken or the egg. So I don't know if it's a chicken or an egg, but it was the primary, and other issues have come from that and staying on. But you can definitely help in manage it, which we'll talk about as well. Issues with the elbow to avoid whole body disbalance. But when it comes to diagnostics, there are a few different things you can do. One being, you've got your imaging, etc., but pain on palpation of the joint capsule itself. When you come into the side of the elbow joint, because you can, the structures aren't, it's not super deep, the elbow joint itself, and you can actually press on the joint capsule and see if there's a reaction. You can also press on a couple of other points, like over the collateral ligaments as well, and see if there's reactivity. And also, I think this is something that diagnoses, or not diagnoses itself, but people complain about it sometimes is, when horses have a really hard time holding their foot up for the farrier because it's being flexed or extended, either reached out in front or because it's kind of being pushed up into itself while it's in extension, then it can be quite painful. So there's two tests. You can either flex it, like you were saying, kind of crunch it up into its, like fold the limb up into itself, or you can basically pick up the foot and you can gesture the limb backwards as if you're doing a stretch, like pushing the toe back towards the hock. And then you can push the knee upwards a little bit. So it's kind of like you're compressing the joint a little bit and see if there's any reactivity from the horse.
Yeah, and with those, the important one when you're doing the flexion test, so the first one where you're flexing it up, make sure that you're not flexing the carpus at the same time. So having your contact on the forearm, so between the elbow and the carpus, so that the carpus itself is either hanging down, or if you have to support it, it's very open, because if you're flexing that as well and they've got carpus pain, you can't tell if it's carpus or elbow. The other thing when you're flexing into the elbow is it can be difficult not to flex into the shoulder. So it's being mindful of that too. And I believe with good feel, you can kind of tell the point at which it shifts through the elbow and goes to the shoulder. And then when you're taking that one, you can also, sorry, I'll just go to the next one, what you said. When you're also doing the test where you take it back, when you have your hand on the carpus above it, the direction is towards the elbow. So you're like creating an upward and a backward direction, thinking about putting pressure into the back of the elbow joint. And you've got to be very careful with doing these, because if a horse has a sore elbow, you can drop him. Like I've had a few where I've gone to do that test and straight away I felt the horse be like, ugh, like, ow. And so they're very good tests in that. But yeah, just be very mindful that if a horse is sore in their elbow and you test that specifically, that they could just drop on you because of the discomfort. And then the other one is taking the leg forward like the farrier, but looking at the elbow extension, where we put our hands around and pull the olecranon towards us to create extension. Again, you've got to be very mindful doing that one, that they don't push down on you, step on you, so it's quite specific to do that in a safe way for you and for the horse. And when I was at a dissection recently, I had a very experienced vet there, a biomechanical vet who was ultrasounding lots of things while we were doing the dissection and practicing her joint injections and things. And she did get a good image of the elbow with ultrasound. The best way to get it is in a flexed with the elbow in flexion. So it's a little bit difficult. It's not like a dog where we can just lay the dog down and then flex the elbow. With the horse, they've got to hold their leg up while you're doing it. So that can be a bit of a challenge. We almost need to give them a sling. And so she, could ultrasound, look at the collateral ligaments, look in the joint. She did an ultrasound guided joint injection, which hit the joint perfectly. And so it is possible to be more specific with your elbow diagnostics. It's just not a joint that's commonly looked at. So, it could be blocked, it could be injected, can be ultrasounded, it can be radiographed, but you've got to know what parts you're looking at in the radiograph. And then obviously if you had an option to do a CT, then that's going to be a nice way to look more completely at the joint. And these have all been documented in papers, those diagnostic procedures. So when we talk about management, do you want to talk a bit about management?
Yeah, well, I mean, feel like we've alluded to them, but hoof balance is definitely a big one. So, keeping your horse on a good schedule. In Sharon May Davis's paper, she mentions, so her paper is called A Joint in Trouble. It's about horses and elbow arthritis. And so, her comments in there as well, which aren't exclusive for the elbow, but maintaining your hoof angle. So making sure that your horse doesn't have low front foot heels, like they're not becoming underrun, and that the toe isn't long either. So making sure that those things are managed. Even, there are people who need to do a little bit of trimming in between their trimmer coming to make sure that those things don't overgrow and put undue forces or mechanics through the foot. So making sure that your hoof balance is there, and the medial lateral as well, making sure that the medial lateral balance is healthy so you don't have, a disbalance going up the limb and traveling up, because that's going to influence the elbow as well. Postural function, so lifting from the front of the shoulder, making sure that like you were saying, it's not a leg movement where you just kind of crunch, like you're just folding the knee and trying to sort of move it forward far enough that you can, achieve a step, I suppose, but it's a genuine lift of the front limb, making sure that your biceps brachii is being engaged so that you're actually stepping forward with the front limb, making sure that you have postural function pre-riding. So going through, maybe your checklist, making sure that your horse has lift through the thoracic sling, that their rib cage can lift, and that their front limb has both mobility and stability, whether you need to use mobilizations and activations as a routine beforehand. And using variable feeding positions is also very useful, especially hay high. So getting them to basically use and lift their thoracic sling properly, and also to activate and use their triceps well. So when you have to stabilize the forelimb, all of those muscles have to engage and stabilize. So you can really help the elbow. We do have an episode on variable feeding positions as well. It's literally called variable feeding positions. It's way back early, maybe in the first 10, is it?
Yeah, I think so. Yeah.
In the first 10. So that's a good one to listen to for something to implement. What else can sort of stands out? What do you recommend for people?
Yeah, I think also like joint supplements. So just having them on a good quality joint supplement pretty reasonably early in their life. So we've done an episode on joint supplements too, so I'd have a listen to that. And we've talked about all the different types and when to use what. And so that's going to be important just for nourishing joint health and cartilage health. Also, just appropriate strength conditioning to prevent overloading of the limb. So, like if you're going to be jumping with your horse or eventing, making sure that they've got good core strength, they've got good upper body stability, and they've got endurance within that strength so that the limbs aren't getting overloaded and you don't have increased forces going through the limbs because they're just not strong enough to do what you're asking them to do. Like they don't have they haven't got good enough well-developed core strength, thoracic sling strength, self-balance, self-carriage to actually support themselves. And avoid hills if they're showing any instability. So to create stability, you want to do stuff on the flat, slow and controlled, um, exercises with awareness and activations and things that are promoting stability. And hills will really challenge that in a negative way. Like it's not about doing the hills because they challenge it in a good way. It'll just create more instability. It's not that often the limbs aren't stable enough to get a benefit from it. And so they're just bracing in order to deal with the downhill motion. So yeah, they'd be, and then obviously saddle fit's massive. And even if, I've had horses where the saddle has been fitted, and I think I've mentioned it before, like I've looked at it, owners looked at it, who was the saddle fitters looked at it, the saddle fitted, but the horse still was showing us in the body that for some reason it wasn't working for that horse's body. So even if your saddle is fitted, if you don't feel like the horse is able to offer their best biomechanics in that saddle, maybe that saddle is just not the right one for your horse. Like if you feel like they have any restricted fall in motion or they're not able to lift optimally, maybe they just don't like the panel type or something in it, or the way that you sit in it, or could be could be multiple things. So you need to consider how your horse actually moves under saddle versus not under saddle, and they should be able to hold themselves without any gear first. That's really important. So join our functional posture course and improve your horse's posture for their elbows.
Absolutely. And the one of the benefits is the fact that so Jeremy Davis talks about the fact that all elbows that she sees in ridden and driven horses have changes, like arthritic changes. And so But many horses, it settles down, it becomes very manageable for them. They end up with a functional a system, a functional forelimb. And so as long as you can do an for the most part, most of the time, as long as you can do enough for the forelimb, build that stability, build the integrity, like what we're talking about, that functional stay system. If you have a really functional stay system and you have a functional thoracic sling system and you are managing their feet well, then for the most part you have covered, the system there as the horse goes through a gait cycle. And we're just talking about getting that gait cycle as functional as can be and helping the elbow to go through a healthy range of motion in a way that's supported well. So if you can do that postural work, you're at an advantage for helping the elbow.
Yeah, definitely. So I think a takeaway for me would be to consider the elbow as a source of discomfort when you've got altered forelimb biomechanics, and to explore, the diagnostic and clinical examination processes of that um, as part of your options in terms of being a body worker or a vet. So including the elbow as a as an option with forelimb dysfunction. Do you have any takeaways?
Stay on top of your hoof balance and keep an eye on your feet to make sure that, especially with, high-low syndrome and, having a flat foot, that it's important to get on top of that to help your elbows
Yeah.
out.
And make sure the feet are comfortable. They can be balanced, but not comfortable. So that's also going to really influence the elbows as well. So awesome. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes. And give us a 5-star rating so we can share more valuable insights. And reach out with any listener requests for topics that you would like to hear us chat about.
And we'll see you in the next exciting episode.